Okay, part two. I'm not sure why the video cut out. Again, I can't figure out the technology. This will be upgraded at some point in the future. Again, my name's Mandy Holstein. Okay, Power of Wellness Health Services is the clinic that I own here in Ketchikan. What I was explaining is if you are sick, this is the elephant in the room, okay? If you are sick and you don't know what to do, there's a lot of panic and concern that's occurring, okay? And like I said in the last video, rightfully so, all right? So I need you, as a person who might have seasonal allergies, the cough, the sniffles, even a fever or a severe cough, or even shortness of breath that you feel, chest tightness, I need you to call first, okay? I need you to call your regular healthcare provider, okay? You can call us too. I can't guarantee that between our limited staffing here that would be able to answer your telephone call in a timely manner, but my first recommendation is that you call your regular healthcare provider, okay? If you don't have a regular healthcare provider, get one. Call a clinic. There are many clinics in town, okay? Call first. Ask a healthcare professional to triage you. You know, should I come in? Should I stay at home? Okay. If you are not showing any significant signs of COVID-19, and believe me, there are criteria as outlined by the CDC, our state public health department has it, our state epidemiology department, infectious disease control have it. We have criteria for COVID-19, okay? Healthcare professionals, we have criteria for COVID-19, okay? We also have criteria for persons under investigation for COVID-19. You need to call your healthcare professional and you need to be triaged, okay? Do not simply rush into the ER, okay? ER, emergency room, okay? We need to reserve the emergency room for emergencies. We need to limit the expenditure of resources to patients who do not require emergency services, okay? And we also need to reduce the potential spread of illness to our emergency room and hospital and healthcare workers and our staff. They are at the front lines of this. They are at the front lines every year on a seasonal and non-seasonal basis. A lot of times we are the first ones to come into contact with somebody's illness, and we have to be hyper vigilant to not take this home to our families, to not give it to our other patients, to take care of ourselves, rest, stay warm, stay hydrated, make sure our immune systems are where they need to be, because we are at the front lines caring for our patients. So what I would recommend is please call your regular provider if you have any questions or concerns, okay? Look for that triage piece first. Do I need emergency services? Do I need to stay at home and, quote unquote, quarantine myself? Do I need to actually travel in to the provider's office, where then I would hope there are protocols in place to reduce contamination in the office? For example, Power of Wellness, we have a designated room. We take patients directly to that room upon arrival. They mask up upon arrival. They complete a pre-screening over the phone. Power of Wellness actually has a written protocol in place that we've created in the last 3 to 5 days to manage this, okay, on a more professional and solidified level. So many practices should have this same protocol in place, okay? So you need to call your healthcare provider, determine if you need to come into the ER or not, if you can be seen in the private care setting, in the clinic setting, then you come into the clinic and you're taken care of there. Do not bombard the ER with illness that is of non-emergent quality, okay? We need to be reserving the ER for emergencies only and protecting our staff and our physicians who are going to be caring for sick individuals. We need to save the masks for our healthcare providers. We need to save our hand sanitizer for healthcare providers. We need to save isolation gowns for our healthcare providers, and we certainly should not be stealing those things from healthcare providers, okay? As a community, we need to be able to rally together and support one another, and we need to take precaution. We need to be precautionary, and we need to do our due diligence to reduce the contamination and the potential spread, because even though you and I may be perfectly fine, we have capable immune systems, somebody that we know or that we love may not. And they could have a detrimental outcome. Similar to the flu, influenza A or B, same situation, okay? So that's why there needs to be this hypervigilance, all right? This is not necessarily a time of crisis. This is not a time that you should panic, but this is a time that you should be aware and you should be precautionary, and you should do a service to your community by taking those additional precautions. Canceling the trips to Hawaii. I know. I get it. I really do. I get it. I get it. But think about that potential travel now bringing that illness back to a community. It heightens that potential spread. And you might be perfectly fine. There's no question. But then what happens when an immunocompromised individual in our community gets it? That's what we need to be thinking of. We need to be thinking of our community here, okay? So like I said, it was a little bit of a ramble. I don't usually post videos, but I at least wanted to address the elephant in the room. And that is, what do you do if you have a cough, if you have a cold? You should not immediately go to the ER. You need to be telephone triaged first by your general provider, okay? And if you don't have one, there's a variety of different clinics in the area, including public health. So utilize your public health department as well. And then we can decide with you, do you meet criteria for screening, or is something else likely? And if something else is likely, then we can go from there. But anyways, keep your eyes out for more information. My hope today is to have an additional page up and going on Facebook for resources for the community regarding this. And yeah, stay well and stay healthy. Bye.